Thank you so much. Thank you so much for joining today's webinar. It's entitled Hepatitis B Advocacy in Africa, and this webinar is presented to you today by the Hepatitis B Foundation and CHIPO, or the Coalition Against Hepatitis B for People of African Origin. My colleague, Beatrice Sovich, is on the line as a resource for you, so if you have any technical challenges, Beatrice will be monitoring the chat and answering any and all of your questions. Today, the webinar will discuss case examples from Ghana and Nigeria, and we have an esteemed panel of presenters who will share their experiences with advocacy at the local and federal levels and provide strategies and tips for each of you that will hopefully inspire you that you can too also have an impact in your communities, whether that's local or at the national levels or country levels, depending on where you are. My name is Catherine Freeland, and I'm the Associate Director of Public Health Research at the Foundation, and I'll be your moderator for today's session. I'd like to thank you all for taking the time to join us today for this important session, and also take a moment to thank and recognize our speakers. I'd like to start our session today by just talking a little bit about the Hepatitis B Foundation and what we do. The Foundation is an international nonprofit organization, and we're headquartered in the United States. We also are dedicated to improving quality of life for those impacted by hepatitis B and working towards finding a cure for hepatitis B. We have selected programs, and I've listed some of them, which really doesn't capture the full picture of the work that we do at the Foundation, but some that you might be interested in getting engaged with. We have a patient consultation line, which answers questions of individuals impacted by hepatitis B and their family members. You can reach us through our social media channels like Facebook messaging or through our email consult line. We have a really vast array of resources for people with lived experiences or family members on really just what to do after diagnosis, how to protect oneself and one's family members, and what do your test results mean. So I encourage you to check those resources out and also share widely with your community. It's a great resource for getting accurate information out into the community. We have a patient storytelling program, and one of our speakers today is actually a member of that program, in which we really elevate the lived experiences of hepatitis B and work to raise the profile and awareness of hepatitis B and dismantle some of the stigma and misinformation out there around hepatitis B. We have an anti-discrimination campaign, and we also have CHIPO, the Coalition Against Hepatitis B for People of African Origin, in which Beatrice runs. And this is a great resource to connect with others from the African community about hepatitis B and get resources and networking, and really strategies and tips and tricks for how you can implement change in your community. So I encourage you to subscribe to our newsletters and get connected with us. And you can always find more information at our website, which is listed here on the slide as well. So I'd like to kind of go over our agenda for today. Obviously, we've done our welcome and introductions. Again, everything is being recorded, and you will get a copy of the presentation if you registered for today's session. We have an esteemed panel of speakers, and I've just have a slight modification to the order of speakers. Pharmacist Prince Okinedo will be speaking first, and he is the founder and team lead of the Hepatitis Advocacy Foundation in Delta State, Nigeria. He's a member of the Hepatitis B and D Global Community Advisory Board for the Hepatitis B Foundation in the US, and a fellow for African Changemakers Initiative. Prince earned a bachelor's degree in pharmacy from the prestigious Delta State University in Abuja, and is a certified pharmacy council of Nigeria. Followed by Prince, Dr. Linda Peter Ini is the STI and AIDS and Viral Hepatitis Program Coordinator for Delta State Ministry of Health, Nigeria. Her areas of interest are safe injection and blood transfusion practices, elimination of mother-to-child transmission as well. She holds a Bachelor in Medicine and Surgery and is also a member of the West African College of Public Health Physicians. Now I'll turn over to our representatives from Ghana, who will be sharing their experiences. Theobald Ansah founded the Hepatitis Foundation of Ghana in 2007 to champion cause of carriers to the hepatitis B virus in Ghana and beyond. He currently is the president of the Hepatitis Foundation of Ghana. Theobald has written over 6 articles and online publications on viral hepatitis and is heavily involved in hepatitis research in Africa. He is a patient advocate and lost 4 of his family members to hepatitis B, and we're thrilled that he's joining us. He's also one of our global storytellers for the foundation. And Richard Larea is the secretary of the Hepatitis Foundation of Ghana. He's been a champion and advocate supporting the Hepatitis Foundation of Ghana in country and beyond, working towards addressing hepatitis B related challenges and working towards elimination. I also just would like to note that we are using the shortened versions of our esteemed panel's bios. They certainly have a wide array of experiences, and I hope that we'll get to learn from them and learn more about their experiences and how they got where they are through their presentations today. But our goals of today's webinar are really to think about how we can prioritize and gain political will and traction for hepatitis B. As we all know, 300 million people are living with hepatitis B, but less than 10% are diagnosed. And there are significant efforts that are needed to expand testing, prevention, treatment, and management efforts to prevent liver cancer. So with that, I'm happy to turn it over to Prince, who will start our session. So Prince, please welcome to the webinar.
Yeah, so thank you very much, Catherine. And I would like to thank everyone joining us on this call. Good morning, good afternoon, good evening, depending on where you're joining us from. And also thank you for the opportunity to do this. And also we'll just head off straight to my presentation. I'll be talking briefly about the Hepatitis B Advocacy Foundation's advocacy drives in Delta State, Nigeria. So we're looking at driving effective advocacy for viral hepatitis in Delta State. A couple of strategies for result-oriented successes that we have been able to achieve lately. And as I was introduced, I'm from Prince, of course, you know. And then I think I will move over to the next slide. Okay. Yeah, so the Hepatitis Advocacy Foundation is actually the very first and only patient-led hepatitis community-based organization in Delta State, Nigeria. And it's also a registered organization here in Nigeria. And it began actually in 2020. That was there was a need for this foundation, something like this to happen when I was first diagnosed of hepatitis B in 2017. And so when I was first diagnosed of hepatitis B, I realized that I felt like I was all alone, really, because there wasn't any form of structure, any form of coordinated systems for care for persons living with viral hepatitis B. And so years passed, 3 years down the line, and then I saw a need to establish this kind of initiative to push out viral hepatitis information and look out for people who are also living with viral hepatitis and see how I could also come in to help. The next slide, please. So the vision we have is to facilitate a future where individuals diagnosed with viral hepatitis are provided equitable care, irrespective of their financial status, race, or social class, to accomplish a future free of hepatitis. And our mission is a very simple one and clear. For us, we want to unite all stakeholders in the fight against viral hepatitis with the ultimate aim of achieving global elimination, and especially elimination for Delta State and Nigeria. Next slide, please. So I'll just run through a little bit about the burden we have in Delta State. Actually, there has not been any statewide survey of viral hepatitis prevalence in Delta State, but from the Ministry of Health, we are getting projections of 5% for hepatitis B, I think, and C. And so Delta State has a population of about roughly 6 million, And so if we are looking at about 6 million persons living, 6 million persons in population for Delta State, and 5% projection, that's about 300,000 persons, not less than 300,000 persons projected to be living with viral hepatitis in Delta State in Nigeria. So
Hi, Prince. Prince, your network is coming through.
Myself and people I know, are we the only ones living with
Prince, your network is coming through quite poorly. It's very difficult to understand what you're saying. I want, let's see if it comes back. Prince, are you there?
Projection we get from the Ministry of Health, 200 major drives for us to see how hepatitis will come up.
Yeah, I think we lost him. Dr. Linda, if we can go to you and maybe you can touch some of the things that have been happening in Delta State. So I'll turn it over to you, Dr. Linda. And then if we get Prince back, we'll welcome him.
Okay, thank you, Dr. Catherine. So good morning, good afternoon, good evening, wherever you're joining this webinar from. First of all, I would like to thank the Hepatitis B Foundation for the good work that you're doing and for putting up this webinar. I would like to say a big thank you. And also want to thank the participants who have joined this webinar. Thank you very much. Thank you very much. So once again, my name is Dr. Linda Peter A. I'm the STI AIDS and Viral. I'm the STI AIDS and Viral Hepatitis Program Coordinator. So, on this slide, we have my little bit about myself. I'm a medical doctor by profession. And additionally, I hold a postgraduate degree as a member of West African College of Public Health physicians. As we all know, public health has to do with prevention, including preventing the spread of infectious diseases as well as non-infectious diseases. So that's just a very short introduction. And in addition, I'm also a very passionate advocate. So over the years, I've known a couple of friends, who have been infected with hepatitis. Unfortunately, I also lost a very dear friend of mine to hepatitis. So she didn't know, and she wasn't on any form of treatment. Gradually, it progressed to affect her liver. And she came down with liver failure, and that was how she passed. So I've had that passion for viral hepatitis, and following that, I became the program coordinator of hepatitis. So I'm really passionate about this cause. I'm dedicated to promoting hepatitis awareness, and of course, ensure access to quality care for all Deltans. So from the Ministry of Health, with regards to hepatitis, we have a work plan which cuts across, activities centered around awareness creation, activities centered around elimination of mother-to-child transmission, and various preventive strategies. So we have a very robust work plan with regards to hepatitis. So far, I just looking at some of the engagements and the advocacy efforts that we've made. So sometime last month, on the 1st of November, to be precise, we paid an advocacy to Her Excellency, and we stated some areas where we need support. So one of the things that we mentioned was the area of free screening for hepatitis B and C, and also support for the anti-stigmatization bill, because truth be told, a lot of people are still stigmatized because of they're positive with this virus. So we also pleaded to her to also assist in that regard, and also for her to launch a statewide campaign, because the truth is that there's not enough awareness with regards to hepatitis. So a lot of sensitization, a lot of awareness creation has to be done. And we also mentioned making, services affordable and available, because not everyone can afford it. In my country, Nigeria, viral loads for hepatitis is quite expensive, and most people have to pay out of pocket. Even the drugs are equally very expensive. So those were the support that we mentioned to her. And okay, on the right, you can see that we had we had a picture with her and her team. And not just her, we also had, it was a high-power advocacy. We had the director of public health. He was in attendance. We had several directors. We had program managers from several programs, from the reproductive health, from the epidemiology units. We also had a representative from the World Health Organization also in attendance. And from our implementing partners, and that is implementing in the states with regards to HIV prevention, treatment, and support. That's ECUS. We also had representatives from them as well. So it was actually a very high power and advocacy. And we're pleased. Next slide, please. And one of the key output of this advocacy was that the governor actually approved the inclusion of free hepatitis B and C screening for pregnant women in Delta State. So it was a major breakthrough. Another key activity that we've done is that we've done a lot of sensitization and advocacy to key stakeholders. So we had a sensitization meeting which involved a lot of major players, a lot of key stakeholders, like the PS, the Permanent Secretary for the Primary Healthcare Development Agency was in attendance. We also had the Permanent Secretary for the State Ministry of Health, and a host of other people were also in attendance. We had very fruitful discussions, in line with how we can push this hepatitis program forward in key areas. So it was a very, very fruitful discussion. Besides that, we also had advocacy visits to some of the tertiary institutions. So we visited the Federal Medical Center, Asaba. We also visited the Asaba Specialist Hospital. So just to, draw their minds to the importance of record keeping, and just to sensitize them about hepatitis in general. We also had Dr. Catherine. I'm sure you can see her in the photo. She was with us all through these activities. Next slide, please. So basically, this is just so following that, we identified that it's important, for any advocacy and sensitization, we need to have a viral hepatitis champion. So I'll just briefly talk about who a viral hepatitis champion is, why it's important, how to identify a champion. So a viral hepatitis champion is an individual or advocate who works actively towards raising awareness, promoting prevention, and advocating for the needs of those affected by viral hepatitis. So they may engage in activities such as education, outreach, support, and advocacy to address the different aspects of viral hepatitis. And why is the viral hepatitis champion important? They are important because they play a crucial role in increasing public awareness regarding the risk, transmission methods, preventive measures associated with viral hepatitis, and they also actively contribute to diminishing the stigma linked to viral hepatitis by fostering understanding and empathy. So I don't think I need to read it out. I'll just pick the headings. So how to identify a viral hepatitis champion: knowledge and expertise, effective communication, as well as community engagements. Next slide, please. So this is just a list of some of our viral hepatitis champions. So all these people have been very instrumental towards these activities that we've done so far. So like I mentioned, we paid an advocacy visit to Her Excellency Deaconess Tobore Overuwari. That is she's the first lady of Delta State. And within 24 hours, we had a circular was out for inclusion of hepatitis B and C, free screening for hepatitis B and C into the health insurance scheme. So that shows the political will, that shows the commitment that we're having from His Excellency as well as Her Excellency. So of course, they are champions as well. And also the commissioner has been very interested in this. He was even also in attendance during the last sensitization meeting that we had, as well as the Commissioner for Women Affairs. The permanent secretary was also in attendance, and she has been very supportive all the way, as well as the Director of Public Health, Dr. Christian Teshola, and also Dr. Mildred Okowa, who is the state epidemiologist, has also been very supportive in this drive. And Dr. Idote, Dr. Rita Opene, of course, myself, I've been in fact, I'm a passionate advocate of this cause, and Mr. Kelvin, as well as pharmacist Prince Okinedu. So these are our viral hepatitis champions in Delta State. So the next step after a successful advocacy, I would say it's successful because, like I mentioned earlier, we have been able to get free screening for B and C for pregnant women into our state contributory health scheme. That's the insurance scheme. So that is a major breakthrough. But of course, we're not going to stop there. We are going to keep, taking steps till we get to our destination. So first of all, we're going to continue awareness campaigns because there's still a lot of people are not really sensitized about hepatitis. There's still a huge knowledge gap about hepatitis. So we need to keep informing the public what this infection is, how it can be prevented, informing people to, get tested, get treated. And also we'll want to build capacity of our healthcare workers so that they can provide provider-initiated capacity building, and also ensure proper data reporting as well. Then as well as policy development. So there's actually a lot that we need to do, which regards to the hepatitis program in Delta State. So we'll keep making steps, the right steps in the right direction. Next slide, please. So looking at conclusions and key points. So collaboration is key. So now that like I mentioned, we have a lot to do, And we can only do that if we have some form of support, be it from healthcare providers, from non-governmental organizations. So any form of support we can get as a state, will be crucial in successfully combating hepatitis, and most especially the impact that it will have on those living with hepatitis in Delta State. Yeah, so collaboration is very key. Like I mentioned earlier, continued advocacy. So we need to advocate for improved access to testing, treatment, and preventive strategies. We also need to empower the community. So information is power. We need to educate the community on the importance of safe needle practices, regular screening, vaccination, and also strengthening the community based network. So we need to ensure that there's a support network, because believe me, there are a lot of people living with this virus, but they feel like they're alone. So if we can strengthen that network, so that people can come out and say, yes, just like Pharmacist Prince has come out, and he's encouraging people to, come out and speak up and have a network, so that we could keep supporting ourselves. So we need to do that. We need to have a very strong support network for people living with hepatitis. And the last and the most important key point is that we are seeking for support for the hepatitis program. So for more support, we're already getting support from the Hepatitis B Foundation, and we're really grateful for that. But we're seeking for more support, partnerships, so that we could, move this program to the next level in terms of awareness, in terms of treatment, in terms of case finding, building capacity, and even optimizing some of our already existing structures. Like we have gene experts machines in our facilities, so we can actually optimize them and also use them for viral load testing for people living with hepatitis, and even support with their medications, which, like I said, are really very expensive. So we need all that to be able to, have a huge impact on people living with hepatitis. So I think on that note, I have come to the end of my presentation. Thank you so much for listening.
Thank you so much, Dr. Linda. It's great to hear your perspectives, and I see we have some questions in the chat box, and we'll be sure to get to those towards the end of our session today. So thank you so much, and really appreciate you being here and sharing your wisdom and being a champion for viral hepatitis, and also sharing your story as well for how hepatitis B has impacted you and your friends. So I appreciate you for that. Now I'm going to try to see if Pharmacist Prince's network is better. So Prince, are you back with us?
Yeah, I am.
Yay. Thanks for
Can you hear
joining.
me?
Yes, we can hear you loud and clear. So I'll turn it to your slide that we could not hear you on. So hepatitis B in Delta State. I'll hand it to you.
Okay, so I'll just continue from where I left off. So the landscape of challenges in Delta State, we've been experiencing a couple of challenges as regards diagnostics and medication for persons living with viral hepatitis, which is a very big one for us. And that's one of the things we are pushing through our organization, and then pushing to the State Ministry of Health, see how they can come in and then help in this regard. And I'm very glad that the State Ministry of Health is really tagging along. And that's a huge one for us. And also some other aspects we're also seeing is issues with poor level of awareness, even among the general publics, and even within the healthcare system, the awareness is still very poor, and that's why we want to really push this so that the awareness can be stepped up. So next slide, please. Okay, so for me and for the rest of my team members, I like to say we are actually going for the jugular. Going for the jugular because I believe personally that the whole essence of advocacy really is to pass.
Oh, Prince, we're losing you again.
To listen to. It involves conveying information to inspire action. This message. Hello, can you hear me?
Yes. Yeah, you were cutting in and out, but I think we heard you. Yeah.
Okay. Oh, sorry. Thank you. Network. Really very bad. And so, the essence of our advocacy is really to push this message to people who can take the big decisions. And that was why, earlier this year, January, myself and my team members, we sat down and looked at it. Yes, we're doing a couple of advocacy, a couple of activities, but we realized that they were just local. And when it came to taking decisions, it's also, it's to taking decisions. So we who can take this big decision straight to the Ministry of Health, State Ministry of Health, because we have people there, are policymakers who formulate policies for health. And so once they take decisions, those decisions can trickle down. And that was the strategy we started adopting this year, and that has given us great results. Next slide, please. So the ultimate for us as the Hepatitis Advocacy Foundation, primarily our concern is to advocate for improved access to diagnostics, care, and medications for all persons living with chronic viral hepatitis in Delta states. Of course, this is in keeping with the universal health coverage. And so, of course, we believe that viral hepatitis definitely is part of universal health coverage. We are not really asking for too much. We just want a situation in Delta State where persons living with viral hepatitis can access care, and this care does not have to be out of pocket. So we could save the future and also save people living with viral hepatitis in Delta State. Next slide, please. So I would like to advise viewers' discretion on this slide. The picture you are seeing there is actually one of my friends who, we lost him 5 months ago to hepatitis. Hepatitis, every people statistics, not just statistics, they are real people. They represent real people. And my friend, unfortunately, was one of those, who is now represented in that painful statistics. So we do not want this kind of situation to happen again, because these deaths are very avoidable. Very avoidable. So that's why we are taking the passion, the drive to really push out this information so that we can have a well-coordinated, structured system of care for viral hepatitis. I was starting from Delta State and we can push it all through. Next slide, please. So a couple of activities that we have been doing, I've been using my own personal lived experience, to push out viral hepatitis information, create awareness, empowering patients to become advocates so that they can also drive, because I believe very strongly that patient advocates can drive policy change. And we are seeing that in Delta State. Prior to this time, we really didn't have this kind of drive. And as I said, when I was first diagnosed with hepatitis, I felt all alone because I looked all around. I didn't see any kind of activities on viral hepatitis. And so I decided to start up that kind of activity. So people who are living with viral hepatitis can also now feel part of the system and then realize that they are not all alone. Next slide, please. Okay, so this was during the antenatal care visits. Okay, I had to do this because in Africa is the primary mode of transmission is mother to child, really. And so if we are able to stop mother to child transmission of this virus, then we can achieve huge success. And so I and my team, we went to one of the central hospitals in Delta State, to raise awareness among pregnant women, the essence of their screening, and then vaccination, timely vaccination of their newborn within 24 hours. And I'm glad to see the response that is coming from these pregnant women. They're beginning to, some of them are beginning to demand for such services. The awareness is really increasing, and that's good for us too. So we just keep on doing this kind of thing to see how we can raise public awareness. Next slide, please. And so some of our activities we did earlier this year to mark World Hepatitis Day. My team, in collaboration with the State Ministry of Health, they have been very supportive to our activities, and I'm very grateful for that. We organized the very first ever Delta State Viral Hepatitis Summit in Delta State. And in attendance were the permanent secretaries, the director of public health, other directors, key stakeholders in the ministry, and also from the hospital settings. So it was a huge success for us. And I thought that, okay, if we could have this kind of success, maybe it's something we could continue. And so that's why we are actually preparing for a second phase, which is the second edition of the Viral Hepatitis Summit, which will be coming up July next year. The preparations are ongoing. And so we'll be putting out a lot of information as regards this. And let me just seize this opportunity to say we will be calling for sponsorship support from wherever we can get. Next slide, please. So our activities are also centered around building collaborations and partnerships with stakeholders. Of course, you can see Dr. Catherine there too. We're able to, when I spoke to her about coming to Delta State, and she obliged, was very supportive, and then we were able to pull her down, thanks to the Baby Foundation. And the State Ministry of Health also was very supportive in bringing her in hosting her too. So, because our activity is really to pull stakeholders to help position Delta State to eliminate viral hepatitis. Not just eliminating viral hepatitis, to ensure that people living with viral hepatitis are well catered for in the scheme of things. And that's one thing I champion in Delta State. Next slide, please. So, leading up to, I think this should be our climax for 2023, where we paid an advocacy visit to Her Excellency. And, it was a big one for us because just shortly after our visits, I think within 24 hours, now, next slide, please. So within 24 hours, she, because she promised us that she was going to look at a couple of issues we raised that day. And the following day, we saw this circular out through the Delta State Contributory Health, because the state runs health insurance scheme. And the painful part is that the hepatitis is really not covered under this scheme. And so one of the issues we raised before Her Excellency was to see that this be covered under the scheme. And of course, she promised. And true to her promise, we were able to see, we saw the circular the following day, within 24 hours. And that's very huge for us. That's the strong political will from the state said in quality health for Deltans. Okay, and so some of the couple of strategies that worked for us, I think, just is one of them was identifying key stakeholders. So we did earlier this year, my team and I, we did some kind of stakeholders analysis. We put out, we make all the noise, but this noise that we're making, are the right people hearing this noise? So we decided to devise a strategy that, okay, let us channel all our efforts towards the ministry and the government, because they are the ones who take the big decisions. While we are also doing public enlightenment and all that, we are also channeling that to the ministry and the government. That was how we went to the ministry. And another thing that worked for me or worked for my team was lobbying using our lived experiences. Each time I met with any of these people at the ministry or in experience, because it is, I realize that each time I tell them I live with viral hepatitis, they kind of relate well. Instead of saying people are living with, but they are now saying one of the persons or one of the people living with viral hepatitis. So they tend to give me listening ear. And I had to now start, using that as a tool, to getting what we really want for Delta State. And there has never been anybody I spoke to about my health, about my hepatitis status that turned me down since I started this drive. And so one thing, I think this was what really stood out for us, in terms of strategy. And so that's one of the things I think advocates should also be looking at. Truly, persons living with viral hepatitis, the community can really drive the change. So imagine a projection of 5%, which is about 300,000 in Delta. Imagine just 10% of that of the 300,000 came together with one voice to speak out. So that's the kind of thing we were looking at going forward. So another thing that worked for us was policy engagement using official data from the WHO, Coalition for Global Hepatitis Elimination Foundation and Health. And so, yes, it's while we're doing the advocacy, we must be speaking with facts. Okay, and so there's hardly a day I don't study things about relating to viral hepatitis. I read journals a lot about viral hepatitis just to update myself. So when I speak about viral hepatitis to these people, these policymakers, they would want to fact check, definitely. And when they fact check and they see that that was speaking something from records, then they want to take us seriously. So advocacy without the knowledge it may be a problem. So that was one of the things that worked for us. Then purpose-driven collaborations. Of course, that was why we collaborated with the State Ministry of Health to organize the Hepatitis Summit for Delta State. So we're also collaborating with other organizations, maybe the faith-based organizations and all that. So we are looking out for more collaborations in this regard. Then awareness campaigns on TVs, we do that a lot, and with our local media. So all these things, I think, worked for us as strategies to achieving the results that we are seeing in Delta State today. And next slide, please. Okay, so this just calls for action from every one of us, that we must unite to advocate for the rights of patients and drive policy change to achieve microelimination and improve health outcomes in Delta State. Next slide, please. So two things for us, two options for us, particularly for myself. Should I wait until things happen or make those things I want to happen? So for me, it's really, waiting is not an option. So we can't sit back and then wait for things to happen. We must step forward and then make things happen for us. What we want to see, the change we want to see, we must start designing them. We'll start acting them. Next slide, please. And so finally, by fostering a collaborative effort and political will, we can drive positive changes and ensure quality care for individuals affected. Next slide. The time, I appreciate and I want to thank the Hepatitis B Foundation again for all the huge support we've been getting. Thank you very much.
Thanks so much, Prince. Now I'll turn it over to Theobald from the Hepatitis Foundation of Ghana. Theobald, take it away.
Thank you, Catherine. Good afternoon, good evening, and good morning from Ghana. Ghana, the weather is very, very hot today, and we are managing it. My name is Theobald Oswan, and my name have never changed. The president of Hepatitis Foundation of Ghana, and also the current board member for World Hepatitis Alliance representing Africa. I'm going to present an overview of Hepatitis Foundation of Ghana. Hepatitis Foundation of Ghana was founded in 2007 when I lost some of my family members to hepatitis, and also I tested positive for hepatitis B. That time, the question I asked myself, hey, what is this disease, hepatitis? This is my first time of even hearing it. So I quickly went to internet and searched for information, and also to see whether I can get any other NGO I can join. So I searched online, I couldn't find any NGOs. All the NGOs was into HIV, malaria, TB. So I decided to fund Hepatitis Foundation of Ghana. That year, it was 2006, I made a plan to establish foundation. 2007, I funded the foundation. It was Theobald Hepatitis B Foundation. And I registered in 2008. So 2012, when Roche called me into their office and told me that, Theo, this foundation has grown. A lot of people know what you are doing. Why don't you, it's time for you to change the name. Why don't you change the name so that it will not look like it's a personal NGO you are doing, but it's a national thing. So I said, okay, give me a week. I will get back to you. So I went back, and 2012, I changed the name from Theobald Hepatitis B Foundation to Hepatitis Foundation of Ghana. And Hepatitis Foundation of Ghana is the only patient organization in Ghana. It's the only patient organization in Ghana. Even when I started the foundation, there were no other NGOs in Africa. It's not only Ghana have made impact. Africa, because I went to Cote d'Ivoire to help them set up a foundation, and other African countries, and I went to Rwanda, and I'm happy what Rwanda have done, because I was the first person I went to Rwanda. That time Rwanda have not done anything in hepatitis in Africa, but I went there doing my advocacy. They promised me that, the time you will come back again, Rwanda will be doing a whole lot of things, will bring up a lot of policies. And now I'm happy for Rwanda. Even my country, Ghana, have not done it, but Rwanda have done it. It's all bound to political rule, because a lot of people are now mentioning Egypt. Egypt is not one day. It's not one day thing they have done. It's political rule. So Theobald Hepatitis Foundation is the only patient drive, and also the national voice for hepatitis patients in Ghana. Next slide. What was the mission? What's the mission? The mission is to eliminate new viral hepatitis infection, and also to improve quality of life. To eliminate, what can we do to eliminate new infection? By advocacy for birth dose, and also test, vaccinate, and treat. And also quality of life. What can we do that to help people who are living with hepatitis? So what we started doing was, I have to negotiate with some of the pharmaceutical companies in Africa, and also Ghana, and also labs in Ghana, to reduce the cost, and also to reduce the medicine, so that people can get access to it. Now, I can tell you for fact now, it's only Hepatitis Foundation of Ghana who is giving medication to patients at affordable price. Let me say, it's the wholesale price, because we don't put any money on it, because I'm patient. Myself, I'm a patient. My family is also a patient. My father, I'm talking about my father's side, they are also patient. So we need to negotiate the price so that the patient can get access to it. Next slide. So what was our mission? Our mission is to prevent infection and also to management of hepatitis among family and friends. And what we did was to advocate for policy. When I started Hepatitis Foundation, there were no policy in Ghana and most of the African countries. So when I started pushing for policy, because when you go to Ghana Health Service, we don't have anybody who's in charge of hepatitis. But when you go there, they have somebody who's in charge of HIV, malaria, but hepatitis, no. So I started pushing for somebody to get an officer where we can channel our problems to him. And in 2012, we got somebody that's the program manager for viral hepatitis in Ghana. Next slide. What is our core values? The core value, we accept responsibility for our collective and individual action. When I say individual action, what we normally do is we allow our staff to work freely, but you have to be professional. You don't have to do things in your own capacity because most of our staff are voluntary. We don't pay them. And most of them, let me say, majority of them are healthcare professionals. So professional responsibility, you have to serve the patient. You don't have to bring your personal gain because integrity is at stake. So we need to make sure that what we are doing is to serve the interest of the patient, not our interest. And also the interest of the partners and the donors. Next. The structures, we have a voluntary lead organization with no paid staff. As I said, we don't have people, we don't pay our staff because we don't have funds to do that. It's voluntary. And also the organization management is comprised of the president. I'm the president, who is the patient. The vice president is also a patient. And we have the secretary, who is a healthcare professional. And I always tell people that I have somebody who's helping us to grow. That's the secretary, because he runs day-to-day affairs of the organization. And he's doing a whole lot of things for us. And we have the communication manager who normally do most of our communication, and the project manager and the program manager, and also the public health manager. And we have people who are in charge of social media and online officer, and also somebody who's also the head of screening team. Because I don't have knowledge, my profession, I'm cybersecurity officer and accounting officer. So I don't have knowledge on this when it comes to screening and vaccination. So we have people who are in charge of those things. And we have the board members who make policies for us. And the board, I'm the head of the board because the president is the head of the board. And we have other members who have expertise in viral hepatitis in Africa and also international. The local professor, I don't know, those who know Professor Luis, he is also a part of the board. And other doctors in Ghana here. And we have achieved a lot since 2007. We are working with Ghana Health Service to establish National Viral Hepatitis Control Program. And the first program manager was appointed, as I said, in 2012. And also advocacy for national policy. When I started, there were no policy in Ghana. So I have to lobby the government to get a policy. And the policy, 2014, we launched the policy, but up to now, we have not implemented the policy because of funding. Next. And also the national treatment guidelines. You know, from 2015 coming, we had a lot of NGOs doing their own things, screening people because of they screen and charge them and leave those who are positive. Because their interest is to vaccinate people and get their money by leave. So to control what their activities, we need the national guidelines. So this one, I have to also actively participated in the development of the guidelines. I was the only patient, or namely the NGO, who represent the patient voice on that treatment guidelines. And also every year we celebrated the World Hepatitis Day, And World Hepatitis Day has been good in Ghana. Now we get a lot of support from government, and we are also working with the government. And as I said, we also negotiate the price of the treatment because the treatment was very expensive in Ghana. And most of the treatment is not controlled, it's not organized by the government, it's individuals who are doing that because they are bringing the drugs into the country. So we have to talk to those pharmaceutical companies. Why don't you reduce the drug? Because we have a lot of patients who are not on medication because they are most of the time they go to this herbal medicine, and then we know there's a lot of complication on that. And also training of community nurses, because most of the community nurses, they are they are into the communities. When you go to the communities, they are there. So we need to build their capacity. And also the healthcare professionals and the patient themselves, because most of the patients, when they test positive, they don't know what to do. So we need to build their capacity. And also provide free screening and vaccination to the general public, and also refer them and seek better treatment. Our work is free. We don't charge for our service. It's free. The screening and vaccination we do is free. And as I said, I was the first board member to elect to represent Africa. And I have written about 6 articles on hepatitis. If hepatitis occurs, the role of viral hepatitis in Africa, the role of healthcare professionals. Next. And I'm also the president is also the part of National Viral Hepatitis Technical Working Group in Ghana. And the HEAT project, that was sponsored by John Wall Foundation. So the HEAT project, we applied for the funding. When we got the funding, we need to work with partners. So we Cape Coast Teaching Hospital or University, we work with them, and also the program manager. What we can do, and what I want to advise my people here, that when you get funds, most of the program managers are facing challenge of funding. So when you get funds, what you have to do is you have to work with them. In Ghana, what we have been doing, what we have done is when we get funds, we go to the program manager. Okay, Dr. Chu, we have this fund. We want to implement this project, but we want your office to take ownership of that project, for people to know that you are doing the project, but we will be at the back funding you to do the project. So this is working for us in Ghana here. And when you go to the Ghana Health Service, you mention Hepatitis Foundation of Ghana, everybody knows us. Even in Ghana here, if you mention Hepatitis Foundation of Ghana, everybody knows us, because we are working with the program managers. We are also working with the Ghana Health Service and the government. We are not working in isolation. Most of the patient organizations or most of the NGOs, they will work in isolation. No, you have to partner with the policy makers, because they cannot go for funding. Most of the funders will not give them the money because they are government. They don't give money to those government. So the NGOs and the patient organization, when you get those funding, you need to work with them. You need to sponsor them so that they will take ownership of the program. And most of our community projects are owned by the communities. We don't own the project. It's owned by the communities, because the project is we want them to be part of the decision making. And also our work education awareness. We educate people. We also create awareness on radio, TV, go to the communities, and advocacy for change. That's advocacy through our work. That's National Hepatitis Program Manager was appointed. Treatment guideline was launched. The policy also was launched. So in advocacy, we have done a lot. And I'm happy to also say this one. Next year, Ghana government is going to implement birth dose. That's the first time government is going to implement birth dose in Ghana. But what I'm seeing, because they just read the budget, the national budget, and I didn't see rolling hepatitis birth dose in those budgets. So I started asking questions, and they told me that they are going to get funding from somewhere to implement that project. So I have to keep quiet and wait. Next year, Ghana government is going to implement birth dose. And support group. we have been helping the patient, most of the patients. When they tested positive, they don't know what to do. Psychology, it affects them. Even myself, it affected my marriage because I got married in the age of 38 years. And I also, my first daughter is 5 years. It also affected my birth, giving birth. So we need to also support the patient to sack them, educate them. So we have done a whole lot of things for the patient and also tailor service for Pacific community and population. So this is a flashback. If you see the picture on our right side, when I started hepatitis education, now if you see this picture and my current picture, there's a lot of changes. This is old picture, 2009. And then my left side is screening we did last World Hepatitis Day, which was funded by Abbott. And the middle one is the program manager, Ghana Health Service, the program manager, that's Dr. Chu. We got this fund, we got the fund from Abbott, and we supported him to organize training for community healthcare nurses. So this is Dr. Chu, and this is the community on the right side. That's the community training we did for the healthcare community nurses, and you can see me. I'm there. On the left is some of the staff of Hepatitis Foundation of Ghana. In the middle, Dr. Ajua J. She is also a board member for Hepatitis Foundation of Ghana, and Dr. Achu. Next. So I would like to thank everybody for giving me this opportunity or listening to me. Hepatitis B Foundation have done a lot of projects in Ghana, not only in Ghana, but African countries. When we get funds, we also try to support other NGOs. If you ask other NGOs in Ghana, every year I supported them with testing kits because we have a lot of testing kits. So we want to donate some to them to also screen people. And we also work with other NGOs in Africa. And living with hepatitis is a whole lot of things. Even I have to take myself. But now I always tell people stigmatization is not problem here in Ghana. It's not problem here in Ghana. Because when I tested positive, that was 2007 when my girlfriend left me because of she think that I'm going to die. But now we are friends. When you see, no, Joe, you have done a good job. I thought you are going to die. That's why I left you to have to educate here. So we need education. We need to educate people. We need to educate. We have to also build the capacity of the patient. You don't have to always concentrate on healthcare professionals, but the patient themselves, you have to build their capacity so that they can come out and speak. So we can't make decisions about us without us. Thank you, hepatitis. We can eliminate hepatitis by 2030 if we all get involved to eliminate hepatitis from Africa. Thank you very much.
Thank you so much, Theobald, for your great presentation. And I'll now turn it over to our final speaker, Richard, to share your experiences in Ghana as well. Welcome.
Thank you, Catherine. Good evening, good afternoon, good morning from Ghana. My name is Richard Yemolai, Secretary for the Hepatitis Foundation of Ghana. I'll be giving a case example from Ghana, what we've done so far. Most of the things have been said by the previous speakers, so just touch on them briefly and then we move on. Thank you. Next slide, please. So this is the viral hepatitis context in Ghana. As at 2001, the scorecard from WHO. The previous slide, please. Previous slide. Yes, okay, thank you, yes. So the scorecard from WHO 2001 African region. Next slide, please. So we realize that in Ghana, the population per million, yes, we are looking at 30 in a million. That is the country burden. The prevalence among the general population is around 9%. Look at the prevalence among children under 5 years, we are looking at 2%. These are the burden. What are our responses to this infection? Do we have a national treatment policy? Yes. Do we have a national strategic plan for viral hepatitis? No. Do we have a testing and treatment guidelines? Yes. Ghana celebrates World Hepatitis Day every year. Unfortunately, we have not implemented the bird dose vaccination yet, which we are about to begin next year. But we are doing well with the national coverage of the third dose pentavalent vaccines for babies. We are doing well. We are doing about 98%, so we are doing well. So you can see the burden is very huge, but our responses to the burden is quite small. We have a lot of work to do. Next slide, please. Next slide, please. So like the other presenters said, majority of the route of transmission in Africa is mother-to-child transmission. And it has been established that when a pregnant mother with E antigen positive, there's about 90% chance that the infant can develop chronic hepatitis B. So in Ghana, it is recommended that all pregnant women be screened for hepatitis B during the first and third trimester. Infected pregnant women should be assessed for DNA, viral load, and then cirrhosis. And when the viral load is also high, they should be put on treatment. And all infants should receive the birth dose of vaccine as soon as birth. But the challenges with mother to child, the challenge has always been affordability, availability of the vaccine, and then the treatment intervention, and even awareness. It's sad that in most of the health care centers, most of the midwives or health officers are not even aware that when the mother is positive, the baby should receive the immunoglobulin plus the birth dose. And then in some cases, treatment interventions for children. It's sad that when a pregnant woman tests positive for hepatitis B, she may have to pay for some of the medical tests she has to undergo for them to assess whether she has to be put on treatment or not. It's sad that people are not aware that at a certain point in the mother or the positive mother has to be put on treatment. So these are some of the challenges that confront mother-to-child transmission and management in Ghana. Next slide, please. However, we have an expanded program on immunization, EPI, which provides pentavalent vaccines for all babies at 6 weeks. Now, the challenge is, we know mother-to-child transmission is a major route, but then why do we have to wait for the baby to be at 6 weeks before we give the monovalent vaccine? So what is happening is mothers are required to purchase the Hep B immunoglobulin and or the pediatric vaccines for their own use. These are very expensive. Sometimes people call us at the foundation that they need these vaccines because, like my boss said, Mr. Theobald said, we have been able to talk to the pharma companies, the distributors who bring some of these items into the country. We talk to them and they're able to give us a reasonable price. We negotiate these prices for them so that the patients can have them at reasonable prices. And also with the cost of diagnosis, testing for Hep B is mostly covered by NHIS, but in some private facilities, payment is required. Another instance is mothers in hard-to-reach communities and rural areas sometimes need to travel several distances to access these interventions, and this becomes a burden onto them. So what we have been doing, apart from the negotiation, is that we continue to educate caregivers on the need to give the best dose to the babies born to positive mothers within 24 hours. In cases where they don't have access to the HBIG, we recommend that they can still use the pediatric vaccine, the monovalent vaccine, and then continue after 6 weeks. And we had a project in the Upper East region some years back. Now we realized that because of the cost involved in getting the HBIG, mothers were really finding it difficult to raise those funds. So we came up with a strategy that if only expectant mothers could make monthly contribution or commitment towards the purchase of the HBIG, right from the first time they visit the clinic and found out they were pregnant, the midwife will counsel them and then encourage them to make monthly contributions towards the purchase of the HBIG, so that when their time is due by 9 months, they would have raised enough. If not enough, sometimes we do support them to get the vaccine sent to them so that they can protect the baby. We also provide free testing kits for health centers and institutions. Next slide, please. Yes, so all in all, advocacy is a very powerful tool we can use. It's a very powerful tool we can use. And the key to this engagement is building meaningful relationship. Next slide, please. So we'll look at 3 strategies that have helped us or worked for us. And I'm sure these might have even reflected in the previous speakers' presentations. So the first strategy is an alliance. We need to form strategic alliance. We need to have effective collaborations. And then we need to have effective communications on all that we are doing or what we do. Next slide, please. Next slide. Yes, so with the strategic alliance, this helps in identifying opportunities. It helps in building trust. It helps in policy reviews and capacity building. You know who you are supposed to work with. Like for us here in Ghana, we always want to work with the programs officer. So we build trust, and he also understands what we do. With the effective collaborations, it enhances credibility, and then he also makes sure that we create a united front. It helps us to mobilize resources for whatever cause we want to do. And then it also ensures accountability. It helps us in using persuasive messages for our education and awareness programs. It also helps us in sending our messages to targeted populations, behaviors, and also builds on the advocacy work we are doing. Just like Mr. Osu-Ansah said, the introduction and the adoption of the Hep B vaccine in Ghana will be from 2024, next year and beyond. The foundation will also embark on an extensive program from January to July in the Ashanti region to scale up the awareness and testing of Hep B and also prevention of mother-to-child transmission. We also use that as an opportunity to support the drive for the birth dose and vaccines in Ghana. Examples of what's in capacity building workshop. The next picture is the former National Viral Hepatitis Control Programs Manager. And then the current one is just after him. You've been able to, next slide, previous slide, please. So we've been able to have events for prisoners, people who have been locked up and forgotten. Yes, through these collaborations, we've had liver cancer awareness with GIs in Ghana. Through these collaborations, we've also had programs for people, corporate organizations, and communities. Next slide, please. Yeah, so through this collaboration, we've been able to undertake the hepatitis evaluations to amplify testing and treatment projects. And that is a sample of what we found. These are the delegates who attended. We also have a sample of the national policy and then capacity building workshops for people or stakeholders who are involved. Next slide, please. So in all, engaging with political leaders requires a strategic and persistent approach. You see, when they are coming into power, they have their own focus. But if we really want to push a course, if we really want to change a policy, we have to be strategic and then be persistent. The good news is that the approach we are using provides a channel to amplify the voices and influence policy decisions. So we are on the right path. On the other hand, too, we need to leverage on these platforms effectively so that we change. Just like my boss said, we cannot do all these things alone without involving the patients group or the people who have been affected. Therefore, we say no decision about me without me. The patient voice is a powerful tool that can influence policy decisions. So I'll end here and then we'll take questions. Thank you.
Thank you so much, Richard. That was a great presentation. And I think all of you had really insightful tips. I really appreciate, the no decision made without me for the patient perspective and making sure they're at the table. And Pharmacist Prince also, said that community can drive change. And I think those are all really key themes that can come out of this discussion that we'll have today. I'll now invite all of our speakers to come back with us. And I think we have some questions in the chat box, but I would like to first start out, and I'll toss this to anybody who wants to answer it. I think it can be intimidating for someone just starting out or just getting involved in starting an organization on hepatitis B from the community perspective. How do you first get started? How do you develop those relationships with Ministry of Health officials? And how do you help identify folks that you should be talking to that really can help move the message and the advocacy and policy forward? I wonder if anybody feels like they can take that one first. Richard, I saw you were off mute if you wanted to try to take that question. Or Dr. Linda, if you wanted to answer that question. Hello.
Maybe I should.
Hi, Prince. Could you share how you identified the people that you needed to talk to make policy change happen, and how you approached them and how you were able to develop relationships with them?
Okay, thank you, Catherine. And I think what really worked for me was, as I said earlier, when I sat with my team members earlier this year to look at our previous activities, realizing that we weren't really making noise, but people who should hear weren't really hearing, or perhaps hearing but not taking actions. So I think one thing is to keep an open mind, really, and then look at the Ministry of Health, understand the structure of the Ministry of Health. Because when we were to approach the Ministry of Health, we needed to identify the departments, involved in this. And that was how I got to Dr. Linda, because I went straight to the Department of Public Health. So we must understand that in the ministry, it is a very big ministry. One can be very confused about, the activities, but people who are directly involved in this, I think that's one step one need to take. Identify these people that are directly involved, and then keep an open mind. And as I said earlier again, because I'm one living with hepatitis, so for advocates, people who want to set up this kind of set up an organization, maybe because of your personal experience or somebody you know very close to you. So you could use that as a tool, really. I remember the very first time I spoke with Dr. Catherine, that first day was the day I told her I'm living with hepatitis. And I could see her reaction. The reaction was very empathic. And that's one tool that I think persons living with hepatitis, we are not really using. We have a very great tool, using our voice, to advocate for the change we want. So I think that was what really worked for me. I don't know if others will want to say some other things. Thank you.
Thank you. Thank you, Prince. And then maybe Dr. Linda, if you could give the perspective from the Ministry of Health, was there something that Prince did or his organization did that helped convince you that this was something to get involved in?
Okay, so thank you very much, Dr. Catherine. Just like Prince has said, patient-led advocacy is key. When I first met Prince and he told me, how he got diagnosed and all of that, it kind of stirred up a passion. However, prior to meeting Prince, I like I mentioned in my presentation, I know a couple of friends that were diagnosed with this infection. So I already had that interest already. So but I think that patient led advocacy was really it's really a very powerful tool to stir the change in a positive way. Yeah, so I would say that was it for me, besides being passionate about the cause myself. Thank you.
Thank you. And I wonder if we can hear from, Theobald and Richard, how do you identify people in Ghana and create relationships with them and identify those folks that can have impact on policy?
Thank you. So I would want to start, then probably Gilbert can continue. So what we sometimes do is we target the corporate organizations, right? And then we offer an awareness or education programs for them. And then you would realize that because it's so effective, it opens the opportunities for connections to other people. And then because we always work with the National Viral Hepatitis Controls Programs and the Ghana Health Service or the Ministry of Health, yes, it carries a lot of weight. And anyone you go to that would want to support whatever you are doing, they want to be sure you are credible. So they look at the people you are working with. If it is not from the Ghana Health Service, it is not from the Ministry of Health, it's not from the Programs Office, how do we know you are genuine? So surprisingly, there are, I would say, big men in Ghana who also have hepatitis B. But because of stigma and discrimination, they are unwilling to open up. But through some of these works, personally, I have had encounter with several of them. And because of the services we provide to them, they've been able to connect us to so many people. For instance, we during our last HIT program, we were connected to the EPI manager, Dr. Achianu. And then through constant and persistent conversations, it has led to the adoption and then the introduction of the birth dose next year. So sometimes you may have to start from somewhere and do a good job and it will connect you to other people somewhere. Thank you.
Thank you, Richard. Theobald, anything to add to that?
Yeah, thank you, Catherine. I think Richard have said, let me add one or two things to what Richard have already said. Working or getting funding support, or maybe working with these policymakers is not one day job or one day thing. When you go to their office, they just open their office to you. And I always say this, first, you have to be credible. And also integrity-wise, you have to be, you don't have any question on your integrity. These funders, there's a lot of funding around, but you need to let them identify you, not you have to identify them. Let them identify you, because when I started Hepatitis Foundation, like even getting support from Hepatitis B Foundation is through John. Because of my work, John identified me and contacted me. Said, "Tio, we have seen the work you are doing in Africa. So what can we do together?" Then I told them, let's do this, that. Even Abbott, I was Hepatitis B, Hepatitis program manager in Ghana connected me to Abbott, because we have been working with them. We are working with the policymakers. When we get funding, we don't say that, oh, it's Hepatitis B, that has the money, so we are doing a team isolation. No, we work together with them, collaboration, we work together with them. So when they see these people, it's okay, there's an NGO here who's credible, who can help us achieve our goals, so contact them. Even Roche identified me, not me identify Roche, because of the work I was doing. So they contact me, Tio, we want to work with you. And up to, let's say, since 2010, I've been working with Roche every year. I've been working with them constantly. So identify funders and the policymakers is not, it's integrity-wise. And the work you are doing should also speak for yourself. Don't look at funding, because when some people started NGO, the first thing is, oh, let's look for funding. Because when we started, I was using my own money to do advocacy. And my company, where I'm currently working with, that's Electricity Company of Ghana, came in to support me, because I started advocacy inside my organization. And because a lot of staff was also living with hepatitis. So now when you come to my organization and mention hepatitis, they will ask you, oh, go and see Theobald, the cybersecurity officer, go and see him, he will help you. So we need to start advocacy inside, and the work you are doing will market you. Thank you very much.
Thank you. One question that came in through the chat, we know that mother-to-child transmission is the most common route of transmission in Africa, but why is it so difficult to implement birth dose programs to prevent transmission in Africa? And I wonder, I know Nigeria has birth dose access and has since 2004. I wonder if our colleagues in Ghana might be able to answer this question as they're going through this challenge currently. So maybe Richard or Theobald, if you could answer that one.
Please, the question again.
Yeah, so could you speak to the challenge and why it's so difficult to implement the birth dose program, for example, in Ghana?
Okay, so from our perspective, the first observation is that we don't have access to the monovalent vaccine. And the EPI relies on a fund that Gavi supports with the pentavalent vaccine. So we, especially for babies, we are looking at trying to put everything together so that it wouldn't be like you give the baby 5 or 6 different vaccines at birth. Even the psychological effect alone. So unfortunately, with what the EPI provides, the pentavalent vaccine, it only comes or it's available at 6 weeks. And because there is no funds for the monovalent vaccine. It means that we have to, if you want, you have to pay out of pocket for them. So there's been several debates over funds, sponsors, and so on and so forth. Now, finally, the government has promised that it's gotten some funds from somewhere to support or begin the birth dose next year. Initially, we had wanted that probably would have started towards the ending of this year, so that by next year, we'll see the challenges we had this year, so that next year would really go in for having at the back of our mind the challenges and then how to overcome them. But then again, because of funds, we have to wait until next year and then see what comes up. But before then, we also wish that there will be a policy direction on how it's going to run. Then it will be easier for everyone to understand. Thank you.
Thank you. Thank you so much, Richard, for that answer. The next question that we have is there any sort of system in place for general health or mental health evaluation and follow-up after screenings or ongoing treatment? So I think this could go to anybody. So maybe if you could speak to some of the supportive programs that you guys are providing for people living with hepatitis B after they've tested positive. Maybe Prince, if you wanted to share what you guys are doing, and then I'll hand it over to our colleagues in Ghana.
Okay, thank you, Catherine. So, yes, there is really no official structured program for counseling at the moment, but that's where our foundation is trying to fill the gap. I remember last year, about this time last year, I had the opportunity of counseling 2 sets of intending couples, because they reached out to me individually. The first was the guy who reached out to me. He opened up to me. I was telling me about how the family was very insistent, bent on not going on with their marriage plans with the fiance at that time. So just because she tested positive to hepatitis B, and the family was very scared. I could understand, from their own point, because they didn't really know about hepatitis. All they knew was that it's one killer, and anyone with hepatitis is likely to die early and all that. And so they didn't want that for their son. So he reached out to me because somebody told him to reach out to me. So I started first educating him on hepatitis and how it can be transmitted. And so he felt very relieved. And so he wanted me to, he pleaded that I should speak with the father, the mother, and the rest of the family members, which I was glad to do. I did that, and I just realized that in the end, I realized it was a lack of knowledge, really. So I remember the father was asking me, so is this all that I need to do, that their son needed to just do, to just get vaccinated and then ensure that the wife follows through with her management and all that? I said, that's all, you don't need to. And they were very excited. In fact, in their church, what they do now is that each time they want to do counseling, they like to call me, to help talk to intending couples too, as regards this. So I think it's one thing the state government will need, the Ministry of Health will need to really look at, setting up this kind of structure for counseling, because mental health in this regard is challenging. I remember when I was first diagnosed, I was almost slipping into depression. And it took me up to a year to get out of it. And so that was why I decided to set up this foundation to see how we could help people who are living with hepatitis to get the right knowledge, empower them with the right knowledge, and then prevent them from going through what I went through. And I'm glad we're doing that. So I think that's very key for me. Thank you.
Thank you. Maybe in Theobald and Richard, if you could speak to some of the support that you guys provide to people living with hepatitis B after first diagnosis.
Yeah, Catherine, can you come again with the question?
Yeah, sure. So can you share some of the support and resources that you provide to people after they've been diagnosed with hepatitis B at a local screening event, for example?
Oh, okay. So most of the time, we just refer them to the teaching hospitals. And you know, when a patient goes to the teaching hospital to see a doctor, it takes 3 months to see a doctor. 3 months before a patient can see a doctor in most of the teaching hospital. So what we have done is, because we are working with most of the doctors in Ghana, we have direct contact with them. So I will just make a call, place a call to them. Okay, there's a patient coming to see you maybe next week, Wednesday. If that patient goes straight to them, they can attend it to him. Otherwise, when you go straight to them, like you don't book any appointment. It take, as I said, to take you 3 months, even sometimes 4 months before you see a doctor. So we normally link them to care. And also, when after seeing the doctor, if they want to do further tests, the diagnosis, we have some of the lab in Ghana, we have partnership with them. So we just connect them to those lab for affordable. Let me say their services are affordable. And also the medication, the treatment. As I said, we are able to negotiate most of the prices with this pharma company. Like the foundation, what we have done is that we get the drugs direct from the importer. So the importer will give it to us, maybe let me say 90 Ghana cedis. So we will also give it to the patient 100 Ghana cedis, because the time will be the transaction charges and other things. So, and those people who doesn't need treatment, we keep on follow up with them, that go and do viral load test, go and do this, go and do that. And those, like the stigma, maybe some people will call us, oh, I went to this organization. They didn't employ me because I'm a hepatitis B patient. So we normally call the organization. And do you know what most of the organization is doing? It because of the treatment. Because the patient has to be on treatment for life. So they want to try to avoid those costs. So we try to talk to them that, okay, it's not everybody who needs the treatment. So why don't you employ them? If the person needs treatment, we can help you get it affordable price. And also in marriages, sometimes it also affects their marriage. So I have to talk to one of the partners. If it is the lady, I have to talk to the lady, educate the lady. If there is the man, I have to educate them. So this is what we have been doing in Ghana here when somebody tested positive for hepatitis.
Thank you.
Yes, and also we have a number of people call day to day for more information.
Thank you so much. Yeah, and I know you guys provide a lot of support and counseling to people too to help them. And I know Prince does the same thing in Delta State. So thank you. So I just want to I think we're running close to time, I think, certainly. And I just want to take a minute to conclude the webinar. And really just emphasize that each of us are advocates in our own right as a community member or potentially somebody living with hepatitis B. We together can drive change and raise the profile of hepatitis B in our various communities, whether that's at the local, the federal level, or even beyond that. So really, it starts with us and talking to friends, family, and loved ones, working to build relationships with local leaders. I think Theobald mentioned, it's not a one-time meeting. It's a long-term relationship that you have to develop over time to make sure that you can drive change. And they will take up the cause that you're advocating for. And really, and if we want to reach our elimination goals for hepatitis B, it certainly will take all of us working together. I want to also take a minute to offer an opportunity for you to connect to us. If you're somebody living with hepatitis B or want more information, you can reach out to info@hepb.org. I've also provided my email and contact information there as well. So if you're interested in getting involved or want to learn more, please reach out to us and connect with us in that regard. But again, I want to then stop sharing my screen and just take a minute to really thank all of our speakers. Thank you so much for your advocacy and being champions for hepatitis and working towards elimination and really driving policy change in your respective countries. You're really making a difference and having a positive impact on people living with hepatitis B. On behalf of the Hepatitis B Foundation and anyone living with hepatitis B or affected by it, really thank you for your work and your leadership. So with that, I'd like to conclude the webinar. And I wish everyone compliments of the season and look forward to seeing you on another Hepatitis B Foundation webinar and connecting. Thank you so much.
Thank you so much, Catherine.
Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you all.